units, by and large, are for short-term use. Most problems can be turned around, patients can be made comfortable, and return home. And the reason is because they say that's what's important. They would prefer to be at home, and that's why this enormous amount of skill and expertise can be brought to bear in the home. Another question you might ask is, well, what about children? Can you get hospice care for children? And the answer is yes. It's sad to think about, and it doesn't happen very often, but children too may have a terminal illness. And you can imagine the distress of parents and grandparents and siblings all needing the same approach to care. This too is available across the country for children with a terminal illness. You might also wonder about the other things that help people feel better. Things like massage or aromatherapy, pet therapy. You remember the last time you held a pet in your lap? And the warm glow that you had petting a dog? That is therapeutic. In the inpatient unit where I work, we have pets that visit patients and their families. It can be more powerful than any drug. The point I want to make is it doesn't matter what the modality. The goal is to help people feel better, have as high a quality of life for as long as possible. You might ask, what is involved in the bereavement support? Some people need an individual counselor. Some people need to meet as part of a group, to meet with others who are experiencing the same sense of loss and trying to find a new normal after the person they love has died. Every hospice program provides bereavement support. The hospice where I work, and in many hospice programs, will take on bereavement cases whether or not the patient was actually cared for by that hospice. So if you know somebody who is suffering because they have lost someone, say in a motor vehicle accident, or they didn't get hospice care, and the person that is left behind is grieving and needs help, think about the bereavement program in your local hospice. I also want to highlight another feature of hospice care that is distinctive, which is the role of volunteers. Every hospice must include volunteers as part of direct patient care. Now you might ask, why would you want a volunteer? But think about it. Isn't it different if someone is with you because they want to be, as opposed to whether they are paid to be there? Volunteers help with chores, can sit with a patient while families go out, can help with projects, read to patients. There are a whole range of relationships that develop between volunteers and patients and their families that is simply out of a wish to be present and to be supportive. Most volunteers had hospice support for someone they loved, and there is a sense of gratitude and wanting to give back, and that's what motivates them to be involved. So let me turn then to some other common questions. How do I get hospice care? If it occurs to you that someone you know may need it or wonder about it for yourself, ask your doctor. Doctors throughout the country generally know about hospices, but frequently don't want to bring up the subject so as not to distress patients. We also know that patients are reluctant to bring this up with their doctors because they don't want to distress their doctor. Do you notice the problem? Two people, the doctor and the patient, out of the best interest of not wanting to distress each other, don't talk about something that can make such a difference to quality of life. want to stress again the answer to the question, is it covered by insurance? Essentially every possible way of providing insurance in this country also covers hospice care. Another question comes up, what if I live too long? Some patients, you might imagine, who get this tender, loving care actually improve. Improve so much that it appears they no longer have a prognosis of less than 6 months. Patients, about 10% of all hospice patients, leave hospice care for a period because they're better and they can come back. They may want to pursue a different kind of therapy. They can then re-enroll in the hospice program. There is such a myth that enrolling in hospice care means it's giving up, when I would suggest it's about adding to care, maximizing the care that's available, making sure that all aspects of who a human being is are cared for with equal importance. Another question that's asked is, what if something new comes up for my disease? There is no one that would be happier at the hospice program than if a new cure was developed for a disease that you or someone you loved had. And there is no penalty. The hospice where I work, we advocate strongly that people get the best care that medicine has to offer. Let's return to Kit. After her 3 years in therapy for cancer, finally reached the point when the most important thing to Kit was comfort. The therapy for her cancer wasn't working, and what was most important to her was her family. Her daughter, who was living in a foreign country, came home and had time to spend reading together. Can you imagine how special that time was? Her grandchildren were a special joy to Kit. Knowing that time was short, spending time with the grandchildren. It took the best of modern therapy to keep her symptom-free and mobile so she could enjoy her grandchildren. Kit was out in a wheelchair with her husband 2 days before she died. When she died, although her family was sad, it gave them tremendous comfort to know that they had had the time, they had the information, so that those memories they created were precious and sustained them even after Kit's death. So in concluding, what I want to leave you with is the conviction that hospice care represents the best that medical care can offer for those weeks and months prior to death, focusing on making sure that symptoms are under control, that your practical needs are met, that your emotional needs, the fears, are met, and that aspect that each of us has, our sense of our spiritual selves, that's something that is greater than who we are, something that we feel linked to. Most people say that is as important as their physical care. All of those are cared for in a hospice program. Thanks very much.